Hello again, and thanks for watching another episode of Easy IVF. In the last previous videos, we focused on discussing the differences between IVF and ICSI. In this video, we'll be covering the indications of intrauterine insemination and why you should consider doing intrauterine insemination. IUI stands for intrauterine insemination. Unlike IVF, which is done outside the uterus, IUI is done inside the uterus. It involves placing prepared sperm inside the uterus to facilitate fertilization. The goal of IUI is to increase the number of sperm that reaches the fallopian tube. This is done by injecting the sperm closer to the fundus or the top of the uterus. The sperm then have a shorter distance to travel to reach the tubes and subsequently increase the chances of fertilization. The process of in-uterine insemination is less invasive, it's less painful and relatively inexpensive when compared to IVF and ICSI. To summarize the process of IUI, first of all, ovulation is stimulated using certain hormonal medications to facilitate the growth of one or more follicles. Ovarian stimulation does, however, require monitoring of follicle growth and hormonal level using vaginal ultrasound and blood tests to ensure the safety of the treatment and minimizing the risk of multiple pregnancy. You can check out my other videos related to the complications of IVF and IUI and ICSIs. So, back to the summary of IUI. After the surge in LH, which indicates that the egg has been released, a sperm sample is washed and concentrated in the lab. The prepared sample is now loaded into a small tiny catheter, which is now injected into the uterus for possible fertilization. The process is very short and simple. If you're having problems conceiving at times, it pays to start from the most basic fertility intervention like IUI and advance to IVF and then maybe IVF with ICSI if a couple of your IUI cycles fail. Here are some of the reasons why you should consider doing IUI. 1. Unexplained infertility. This is normally the first option for couples who can figure out why they are not getting pregnant. It helps give the physician a better understanding as to why the individual is not getting pregnant despite the normalcy of the participating couple. So basically everyone is good, but they can't really figure out what's going on. So starting off with IUI might just help define what's actually wrong with the couple. Most of the time, these couples actually get pregnant just doing an IUI intervention. It might just be timing or some other factors that is beyond the scope of medicine. 2. Cervical hostility. The cervix opens to the vagina and the uterus. The mucus that is produced around the time of ovulation normally provides an ideal environment for sperm to travel from the vagina to the fallopian tube. If the cervical mucus is too thick, it may impede the movement of sperm to the fallopian tube. Using IUI can bypass this problem because the sperm is in a catheter and the catheter goes directly to the fundus of the uterus where it is deposited, and it has a shorter distance to travel to fertilize the egg in the fallopian tube. 3. Single female or women in same-sex relationship. If you're a single lady or an aspiring single parent and a woman in same-sex relationship and you want to get pregnant, IUI might be the easiest and the cheapest option for you using a donor sperm. Fresh or frozen donor sperm are obtained from sperm bank or donor and they're injected into the uterus. So if you're a single lady and you feel like you don't need a guy, go girl power, you can get yourself pregnant doing IUI, be a single mother, be proud and live your life to the fullest. 4. Another reason why you might consider doing IUI is mild male factor infertility. If your partner's semen sample and analysis shows below average count, and maybe probably a slow a lower motility and progression, IUI can be used to overcome some of these problems during the sperm preparation. So basically, the semen is put through a gradient, and the active motor sperms are recovered, they are concentrated, and they are used for insemination. And so because it's targeted, the sperm can be delivered straight into the fundus of the uterus, where it has a short distance to travel, and that will get to the egg, and possibly fertilization might occur. Another very important factor why you should consider IUI is semen allergy. Some people are very allergic to sperm. So few men do have allergy to the proteins actually present in the sperm, in their partner's sperm. And after sexual intercourse and ejaculation into the vagina, they experience sort of redness, burning sensation, and swelling around the pelvic area, which is a sign of immunologic reaction. Using IUI can be an effective way of getting pregnant and avoiding the symptoms, because many proteins are removed before the sperm is deposited into the uterus. You can also enjoy sex by using condoms, and anytime you want to have a child, all you need to do is go to the hospital, get your sperm in a container, have them wash it, take out the proteins, and inseminate your wife with the sperm for a possible pregnancy. The last and final reasons why you should consider IUI is when you have ejaculation issues. Some men have hypospadias, meaning that the opening into the urethra, like the opening at the tip of their penis, is not in the center. It's located under the penis, not at the center of the penis. That would cause a retrograde ejaculation. Basically, instead of them to shoot forward when they are having sexual intercourse, they shoot downwards. And when that occurs, most of the ejaculate is lost, and that might reduce the chances of a woman getting pregnant. So simply using IUI can improve the chances and outcome of this couple to get pregnant. Again, if you're using IUI, when you ejaculate downwards into a cup that's collected, washed, concentrated, and transferred back into your wife, and possibly she can get pregnant. To summarize, IUI is cheap, and it's not bad to have 3 to 5 shots at IUI before moving on to IVF or RICSI. The average cost of IUI in the US is about $895. In Canada, however, if you're in the province of Ontario, you get unlimited shot at IUI. Yes! So if you're in Canada, you can also move to Ontario if your province doesn't cover that. Move to Ontario for about few months and get enrolled and get free shots at IUI till you get pregnant. Although it's covered, the drugs are not covered. You get to pay for your drug. It's not part of the expenses that is covered by OHIP. It's no brainer, however, to start your cycle from IUI and then proceed to IVF if need be. Thank you so much for watching these videos. Some of you might wonder why I make these videos. I do have passion to assist people who do not know how to get help. Just so you know, 1 in 6 couples have issues with infertility. That will translate to millions of people around the globe struggling to have a child. If you know someone, or if you have a sense of someone who might benefit from this video, please feel free to share this video to reach someone and help someone in their journey to having a child. Thank you again for watching, and cherish life.